Are you taking a fish oil but not sure if it's safe, effective, or even worth it? And I'll give you everything that you need to know about this very common supplement. There's two big problems that I see with it. It can be very expensive, and at least 90% of the patients are not getting enough of the right quality. What is fish oil? Fish oil falls under the category of omega-3 fatty acids. Fatty acids are considered essential, meaning that we cannot make them in our body and must get them through our diet. They can be broken down into three different forms: ALA, EPA, and DHA. EPA can be thought of as more functional. DHA can be thought of as more structural. ALA is the more plant form of omega-3 fatty acids, and it can be found in substances like walnuts and flaxseed. Unfortunately, our bodies don't do a great job of converting it to those more useful forms of EPA and DHA. So who should take a fish oil supplement? The conditions that have some excellent evidence for the use of fish oil in them include high triglycerides, heart disease, depression, painful periods, rheumatoid arthritis, ADHD and ADD, asthma, anxiety, and seasonal allergies. There is some good evidence for the use of fish oil in osteoarthritis, elevated blood pressure, bipolar disorder, specifically the depressive component, dandruff, low back pain, and chronic pain in general. Let's talk about the actual dosing of it. The two things that you need to look at are, first, that most of the fatty acids are coming from EPA and DHA. Next, you want to look at how many milligrams of each of those per serving. And it's very important to look at the serving size. And remember, 1,000 milligrams is equal to 1 gram. For general health and prevention, the goal dose is around 1,000 to 1,500 milligrams. If you're targeting heart disease, high blood pressure, at least a minimum of 2,000 milligrams of seasonal allergies or rheumatoid arthritis, higher loading dose followed by a lower maintenance dose. Somewhere in the realm of 4,000 milligrams to 5,000 milligrams for 6 to 12 weeks. For rheumatoid arthritis, the maintenance dose would be closer to 3,000 milligrams per day. For allergies, it can be a little bit lower, 2,000 milligrams. For depression, anxiety, ADHD, cognitive decline, you're shooting for that 2,000 milligrams to 3,000 milligrams